Hi, it's Adrian from Advanced Dental Artistry in West Perth. I want to talk today about designing the perfect smile. This is probably the most complex presentation that I'm going to give. Designing a perfect smile really goes into all aspects of our dentistry, whether we're doing one single tooth at the front all the way to doing a mouthful of veneers, or we're doing all-on-4 treatment or implant treatment. When we're talking about designing a perfect smile, there are many factors that go into doing this, and there's many steps that we do, and some is stuff that we do with the patient, others is with the technician, other stuff is by ourselves. There's a lot of planning involved that actually goes into it. This is kind of a summary of those steps of what we do in order to get a perfect smile. I'm going to use Paula as an example. Paula's 45 and she came to see us in 2014. A lot of the times when you go and see a dentist, what they'll do is they'll take a lot of photos of your teeth. So you'll see this is a close-up of Paula, you'll see her from the side view here, you'll also see her from the other side. And although this is very important because yes, we are working on teeth, there's a lot more that goes into just designing a perfect smile than just looking at the teeth. So what makes a perfect smile? Well, first of all, I think the most important thing is to listen to the patient and listen to the client. When a patient comes in or client comes in to get their smile done, you've really got to sit down and listen to what they want. You know, we get different patients that come in. Some people want a Hollywood smile, a really white, bright, perfect alignment. We've got other people that come in and say, you know what, I want a smile that really reflects my personality. I want it to suit me. And I don't want people to know that I've had cosmetic treatment done. I just want them to know that I've got a beautiful smile. They're two very different clients. One of the most important things we do is actually what we call the smile design appointment, where we sit down and actually go through this with the patient. We'll allow patients to basically open up and tell us everything that they want in their smile. One of the things that's really important is to bring in photos, and I know that a lot of our patients bring in Julia Roberts. She's got a beautiful smile, but naturally we need to actually find out what they like about that smile. We also sometimes get photos from when they had a beautiful smile. We've got older patients that come in and they'll bring in photos of when they're in their 20s or 30s to help us get an idea of what their smile used to look like, so that we can work towards that to make sure that the smile we give them complements the harmony of their face. During the smile design visit, we actually go through a couple of books, and there's a couple of textbooks that are actually very big in cosmetic treatment, and that is actually looking at the teeth very closely. I know that there's a lot of discussions around certain things like golden proportions and symmetries, and you have to remember that golden proportions was really designed if everything was perfect. But because we're so individual, every tooth is different. Even with this diagram, you can see the lines of each tooth are different, the sizes of each tooth are different, and we need to consider that, so that if we're going to design an individual smile for the patient, we need to consider all these factors. So what we really look at first is we want to step back from the patient. We want to step back and look at their face. So we're looking at the harmony of the face and how we're going to set up the new teeth and the smile to suit or to be in the harmony of their face. Secondly is to walk a bit closer to the patient now. So now what we're doing is we're looking really at their lip contour and the lip support. We know that teeth actually support the lip. So if someone's got a very thin lip, we can sometimes make the support of the lip better by actually changing the position of the teeth. And finally, then we go right to the individual teeth. And the individual teeth means the color, the texture, the translucency, the shape, and the position of those teeth. So when we talk about all of these three aspects, what we do here at Advanced Dental Artistry is we look at firstly at facial analysis. What we're doing here is we're analysing the face through digital smile design, and what we're doing there is we're cloning a patient with digital technology and then working to ensure that the new smile or the new teeth are in harmony with the face. Second, we look at lip and teeth position. So what we're looking here is where does the teeth and the lips, how do they sit in order to complement each other? And lastly, then we look at individual teeth. And the best way to create the best smile or the most beautiful porcelain is really to have an on-site ceramist. So this is Paula. This is a smiling photo of her. And we take a lot of video at Advanced Dental Artistry. One of the reasons for that is that we know that people have learnt to smile a certain way. When someone smiles a certain way, it means that they have kind of learnt, or they've got a certain posture or pose that they do. When we take video, we know that they can't hide from us. So what we can then do is look at views from different angles and work out how their lips function and how their phonetics are. Because we know that if we're changing teeth, there are sometimes going to be some changes to the pronunciation, so we need to take that into consideration. We then do what we call a digital smile design, and this is when we look at the face. This is the harmony of the face. We know that there's certain line angles. For example, if we look at the lines between the pupils and then we go to the middle of that, that's what we call the midline. We also look at the plane of the eyes, and we know that the plane of the teeth should follow the plane of the eyes. We also look at whether there's symmetry between the left and right hand sides of the face, because naturally if there's changes to the left and right side of the face, that may also change how the smile looks. When we look at this view really close up on Paula, we can see that the front teeth are not level. We can see, for example, the lateral tooth is actually longer here and it's shorter on the other side. The canines are not the same level. The other aspect to look at as we walk closer to the patient is also to look at the gums. So it's not just the teeth to the face at this stage, we're also going to start to consider where the gums also sit. This is a really important view for us too. This is called the 12 o'clock view. And what we're checking here is lip support. We can see, for example, on the lower lip, there's a border called the wet-dry border. And this wet-dry border is basically where the dry part of the lip is, the outside, and the wet part. And usually the teeth should sit basically on this wet-dry border. If it sits too far forward, we know that people look quite bucked. We know that if it sits too far in, sometimes there's no lip support. So this also shows you here, if we look at Paula, is that one tooth is actually further out than the other tooth. If we're trying to create beautiful aesthetics, what we really want to do is have that plane all correct all the way around. One of the views we always take is, of course, this full frontal view, and this is really the stock standard view that we're going to use to actually create a beautiful smile. The important view is the same view, but without the lips in the way, because now we can see the teeth. So these are identical photos that we've taken, but the only difference is now we've retracted the lips, and this allows us a much better view of the teeth, and it allows for much better planning, and you'll see that in the next couple of slides. We then can use a caliper to actually get the size of the front tooth. So if we can get the size of the front tooth, we can then analyze the photos by calibrating a ruler on the photos to determine what size of teeth we should actually have. So these are those two photos. Basically, we've got the photo of Paula smiling, and now we've actually got a close-up view of Paula with the lips retracted. What I've actually done is we've actually worked out that her front tooth is around about 7 mils, so I can now calibrate this ruler by making it bigger or smaller. So now I know the measurements around her mouth and I can make changes. Of course, we talk about the planes of the teeth. This is the golden proportions, and the golden proportions actually for a width-length ratio of tooth, they say it should be about 77%. Unfortunately, that would be if everything else was ideal. So if we're looking at golden proportions, we must look at it loosely. If we're trying to create individual teeth, we want to actually have a sort of range, and the range is actually between about 70 and 80%. So by actually now being able to measure things, we can actually get an idea of how we should lengthen or shorten teeth, or maybe should we lift the gum, because you can see in this instance, if we're going for 75, we know that the gum might be lifted. We also know in Paula's case that she's got a bit of a gummy smile, so that would really enhance her smile if we're going to actually do that. Now that we've actually calibrated the ruler, we can use this ruler for gum work too. We can check, for example, on the left-hand side, her gums are definitely lower down than we have on the right-hand side. So we can now measure, for example, if we need to do minor gum lifts, what the height of that change should be. It's also the same with the front teeth. If we need to do any minor changes to the gum, we can measure it precisely. We can then outline the tooth, and the computer will tell us the ratios of the teeth, if they're right, if they're perfect, or whether we have to change the position or the size of the teeth to get a better ratio. We can also measure individual teeth and individual gums. So now that we've got a calibrated ruler, we can actually start to measure different areas of the mouth in order to ensure that we know exactly what we're going to do before we start treatment. We can then also go back to the correct shape of the teeth, and what we can then do is overlay the correct shape of the teeth according to our measurements. From here now, we can actually select teeth. We know, for example, from Paula, she asked for ovoid teeth. She likes that oval shape, that soft shape of the teeth, and we can now overlay teeth over her teeth so that we can work out exactly the correct position and shape of her new teeth. And it's exactly the same in this plane. We talked about how some teeth were out and some teeth are in. We also worked out where the wet-dry border is, where the dry part of the lip is, and where the wet part of the lip is. And we can now also gauge how far or how back we should bring these teeth in to give the best lip support. And of course, we like to give Paula, our patients, an idea of what the final result is going to look like. So here on the left-hand side, you can see her before. And on the right-hand side, we've used the new teeth that we've overlaid over her smile to actually show us what the final result will actually look like. So what happens from here now is we get what we call a diagnostic wax up. That technician who has helped plan this, and we've gone through the digital smile design, we plan the size of the teeth, we will actually create that on a model of the patient's mouth. And this then gives the idea for the patient. The patient can look at this model and give us an idea of whether they're happy with that shape. This is, of course, all before we start planning. So most of the planning at this stage has been done without the patient. We've taken some photos, we've taken some models, but the patient has given us their input, but now we're showing them all of our work that we've done to get to this level. The patient may look at this model and say, you know what, I thought those front teeth are too long or they're too short. So we can modify this before we do any work on their teeth. When the patient is satisfied with this, then the situation is we can start doing treatment. One of the really important aspects is actually not only seeing a trial smile on a model, but actually seeing what it looks like on the patient. The patient needs to see what the final results are going to look like. Again, we either use video to actually do that, and we use photos, but the idea is to allow the patient to trial their smile. And this allows them to really critique the smile and give us feedback. Do they need any changes made before we make the final porcelain? Trial smile here again, you can see the side view, and we've done treatment. We've just basically looking at the position of the teeth, the length of the teeth, asking the patients about the colour and whether they're happy with it. Naturally, we will provide photos for them so they can also see whether from photos they also look correct. We've got on-site technicians. Libby's actually downstairs in the lab, and her role is to really help in the design process, but then to, of course, manufacture the porcelain. And this is a very time-consuming process. It can take up to 3 to 4 hours just to make one veneer. So this is Libby. I took this picture yesterday of Libby with her brushes, and what she's doing is she's actually staining and glazing the veneers. These are the final porcelains actually on the model, and of course the final smile in the mouth. So we have a look at Paula in the final video, and you can see her smiling here. And of course, we're going to take a final portrait actually after this. There's Paula and I, just after we finished doing treatment. Definitely longer hair then. And this is our final portrait of Paula. And you can see what a beautiful smile she has. So if you have any questions, please feel free to give us a ring at 1-800-SMILING. We offer complimentary visits to answer any of your questions. You can also email me direct at dradrian@adaperth.com.au. I look forward to seeing you in the practice.